Hey guys and gals, it's Dr. Marcy, and we are going to look at the blood work of a 50-year-old female who was diagnosed with MS 30 years ago and got herself to a point where she no longer needed medications for MS, but she's currently having some health issues. I did do an evaluation on her back in February of this year to look at some things that were going on with her, including she had a issue with heart condition, nervous breakdown type issues, where she seemed to be recovered, but she was still having a lot of swelling with exercise, and also got diagnosed with bradycardia. Bradycardia, if you don't know, is where the heart rate slows down to a level that we are not comfortable with and want it to be a little bit higher. So I'm just going to share my screen with you so you can see what I'm seeing. She's been reports that she's been sick for 6 weeks, hospital twice, and the most recent trip was on the 2nd of December. So these are blood work from December 2nd, February of 24, August of 23, May of 23, December of 22, and January of 21. The first thing I noticed is that the lab flagged her blood sugar as low. If the lab is flagging it as low, that means you are failing your exam. Everything else that they think is normal that I haven't highlighted is in a or B range. Everything that they think is normal that I have highlighted is you're still, in my opinion, getting a C or a D on your blood work exam. So if you notice, in May of 2023, her glucose was elevated, but it was really low prior to that. And I'm not sure why this 68 wasn't flagged by the lab when the 82 and the 83 were, but it was a different lab at that time. So their lab values may be slightly different. This 83 means that she's metabolically unstable, and we want to really figure out why that is. Now, she eats really clean. She exercises probably a little bit to excess, but we want to really help understand why this is so low. Hemoglobin A1C was tested in 22 and tested again just this past couple of weeks, and it stays pretty consistently in this range, and she stays pretty healthy again with that. This is a measure of how sugared up her blood has been over the last 3 months. Here's where we see a little bit of issue, and it does show up lower as well. Her BUN, if this number is lower than 15, we see difficulty digesting protein and absorbing protein because the hydrochloric acid is just not high enough. This can be due to a couple of different things. Sometimes it is due to an H. pylori infection. Sometimes this will allow an H. pylori infection to come up because the hydrochloric acid needs to be high enough to control that H. pylori. H. pylori is present in the system almost all the time, but just like Candida, if the situation is not great, it will overgrow. Creatine in August of 23 was high, and it was high again in January of 21, but other than that, maintains pretty stable. Again, she's been sick for 6 weeks, so seeing this sodium high, adrenal stress, and fatigue, not shocking at all. There's no real other indication, though, that she's been under adrenal stress. Now, this is the one that kind of shows some problems. Basically, her whole system is too acidic, and we need to change that for her because I think it will make a huge difference in how she feels. And we just need to get this number to come down. She, even back in 2021, was outside of the normal range for carbon dioxide. And this will change with your diet nutrition. But if we continue to do the same things over and over again, and also we're over exercising and breaking down muscle tissue, this will stay really high. And you can see I said she doesn't have high enough BUN to have high enough hydrochloric acid. There is a protein deficiency here, even though she eats high protein. There's also some issues with leaky gut, where we're seeing that globulin ratio be off, and then her albumin to globulin ratio is also off. And we just want to clean that up. Back in 23, her bilirubin was high, and this was all leading into that heart issue that she had. So these numbers being high doesn't really surprise me. The AST was also really high at this point, and that again, indication that the liver and gallbladder just aren't doing their job very well. The ALT and AST were also high and marked by the lab as high in December of 22. So this was kind of leading into a bigger problem, and it just wasn't being addressed appropriately. You can kind of see here, this is at the top end of that AB range. It's still fine, but we want to make sure she doesn't get to that point where that gallbladder liver is under stress again. There has been no measure of her ferritin, iron, etc., which I think is kind of problematic, and you'll see why in a little bit. But the lab flagged her cholesterol as being high, this time being high in 23 and being high in 21. This woman has MS. It attacks the myelin sheath of the nerve. So this is someone who, even though I say 220 is the upper half, at 224, I am not worried because I need her to have a little bit more cholesterol to support continuing to wrap the nerves in myelin, if that makes sense. So again, taking into account the entire history of the patient. Now, the one thing I don't like to see, this triglyceride number is pretty low across the board. This is an indication of autoimmune. And then this HDL being high, also indication of autoimmune. The LDL being this high when it's been so good for so long, we kind of wonder what changed here and what's happening. A lot of times when this number gets out of control, it has a lot to do with inflammation, but her inflammatory markers look really good. So we need to find out what's going on here. Sometimes this can be an imbalance in the thyroid. She did start thyroid medication in August of 2023. And she was on a T4 only when we think possibly a T4 combo med would be best for her. And the reason is her T3 is always low. Yes, her T4 is also low, but that T3 being low, this is an issue with the liver and the gut, not necessarily an issue with the thyroid itself. So we just kind of want to pay attention to that. Her vitamin D was low in 2022 and 2023. She's gotten it up. So her body should be more readily able to fight off little infections. But whatever she has been exposed to has definitely taken her out for the last 6 weeks. And we want to figure out exactly what that is. If you notice, her white blood cell count is chronically low. And it got flagged by the lab this time. It was flagged by the lab in 22, flagged by the lab in 21 as well. Not flagged last February, but definitely something was happening. The other thing we want to note is that her hemoglobin was low on those times as well in 2023 and in 2024, which means that she couldn't really bind iron. So knowing that, they probably should have followed up with an iron test, and they didn't do that here. Her MCV is chronically high. This is an indication that she does not methylate. It was even flagged by the lab back in 2021. So we want to be aware of that as well. This RDW low is a need for iron. So we know that there's a potential there that she has a need for iron. It may just be that her body is a little bit depleted at the moment because of this infection that's going on. You've heard me say this a dozen times. Neutrophils should be 60, lymphocytes should be 30. The closer they get to 1-to-1, the more present your autoimmune condition is and the worse you feel. And once they get inverted, so your lymphocytes are higher than your neutrophils, you really feel quite awful. And she honestly had something happening back in 2022 that flipped these numbers and inverted it. It was a pretty big viral infection. Her monocytes were also the highest that you'll see them on her blood work. And then her eosinophils were also very high, which is an indication of food allergies, parasites, mold, but also viral things like to come up with this. And what it looks like, honestly, is that they treated whatever this virus was, but they didn't go after anything that could have been bacterial, and they flipped these numbers. And then this differential wasn't done in August, so we don't know what it looked like. But right now we're sitting at low ability to take care of bacterial and fungal things, really high viral load again. Food allergies, parasites, mold are coming up for pretty strong. And this food allergies, parasites, mold has been an issue for a while. So this is one of those times where, if we last February could have done some food sensitivity testing, I would have loved to have done that because it would have shown us what she needed to avoid. But the other thing is she did just recently move back into a home where there is a cat, and cats are known for having parasites. And then the area that she's living in is very humid. It is prone to mold, and we think there may be mold in the apartment where she's living. If not actively growing, there has been mold in the past, and that needs to be taken care of. She is on a thyroid medication. She's also on testosterone replacement, but this DHEA is still really low, and we want to get that up because it's going to help her feel better in general. So we just want to be aware of that and pay attention to this as well. Again, in February, she was at 31. Now she's at 188. This doesn't happen in women without supplementation unless there's a genetic dysfunction that happens. So we really want to pay attention again to this chronicity in this infection, the fact that it is viral in nature, but we don't want to discount parasites and mold, especially given that it was doing better when she wasn't living in this environment and now it's crept back up again.